Today, the World Health Organization warned that millions of Pakistanis affected by historic floods are now at risk of waterborne disease. Areas in central and southern Pakistan are still underwater from torrential rain and glacial melt, and the water keeps coming. In the last day, 70,000 more homes have been damaged, adding to the 1 million homes already damaged or destroyed. Nick Schifrin is back with more on the humanitarian crisis.
More than 6 million Pakistanis are in dire need of humanitarian aid, and UNICEF says some 3 million Pakistani children are at risk. To discuss what they're facing, we turn to Abdullah Fadl, the UNICEF representative in Pakistan. He's just back in Islamabad from the flood-hit regions. Abdullah Fadl, thank you very much. Welcome to the NewsHour. Of the more than 1,000 people who've been killed by these floods, more than a third have been children. Are Pakistani children today particularly vulnerable?
Absolutely, Nick. Children are vulnerable because they are more susceptible to diseases, cholera, diarrhea, malnutrition. So this is a devastating calamity for entire communities in the nation. I mean, the most hardest hit provinces, Balochistan, for instance, initially, is one of the most deprived provinces in the country. And the communities that actually were the most deprived are actually the ones who have the least infrastructure to withstand floods. Their crops have been decimated, their animals have been decimated. The same way in Sindh, where millions of people are also impacted.
The scale is just unprecedented, and many victims of the flooding have described receiving no assistance from the government or from NGOs. Is that what you're seeing? How difficult is it to reach people right now?
Assistance comes actually, but not in the sufficient quantities needed or what actually the calamity requires. We've responded in the first few days, the government responded. But Nick, it's a big country, Pakistan. And the vastness of the floods just makes it impossible to reach everyone. The logistics nightmare of roads have been washed completely. 3,000 kilometers of roads, almost 2,000, a few hundred miles of roads. Bridges have been completely decimated. So the military actually reacting and actually sending almost 7,000 troops to respond is the right approach. We're all trying to do all we can. UNICEF, for instance, as I said, we delivered water to communities in need. We've delivered medical supplies. We've delivered hygiene kits. Our warehouses are completely depleted. And now the UN launched with the government $160 million of humanitarian life-saving appeal to come in as soon as possible.
You just described some of the items that you're delivering. What do people need most right now?
They need shelter. Today, when I went to Nowashera, I saw actually people on the highways, the sides of the streets, basically with makeshift camps. They don't have enough. They're using plastic sheets. They're using their clothes, sometimes even boxes. People need actually shelter. They need food. They need water. They need medical supplies. They need medicines. They need almost everything you can imagine. They need clothes. And children who are actually tired, who haven't had cooked food for some days, need hot meals as well as ready-to-use therapeutic foods.
UNICEF says some 18,000 schools have been damaged or destroyed. It would be, of course, the beginning of the school year right now. What's the prognosis for education for so many of these children who have had to evacuate their homes?
Disastrous. Remember, we had 2 years of COVID with so many closures, and actually children were already lagging behind. Pakistan has almost 23 million children out of school already. Now, those who were actually in the school and who were trying to recover from learning gaps, all of a sudden don't have access to learning facilities. We're trying to actually get tents to make sure that children can go back to school as soon as possible. This is going to be really, really critical to make sure that within a short period of time, children are able to go back to school.
And what about the psychological impact on children? How difficult is it for them when their parents, when their caregivers are themselves so affected?
Children who were actually out of nowhere in the middle of the night moved from their homes, not sure that whether they will survive the waters. I mean, perhaps even knowing people who have died, other children who have died. So it's quite traumatizing, being uprooted from their own homes, but also not eating for 4, 5, 6 days, their livelihoods destroyed. So it's quite traumatic for children of any age, but these children particularly, who were already vulnerable, are really facing a daunting task ahead of them.
What are the conditions in the camps that so many people have had to flee to?
One of the camps I visited today, it was really horrendous. I saw a woman who had 6 children, 4 girls and 2 boys. Actually, her elder son spoke a bit of English, and he was saying, for 5 days, we've been away from home. I want to go back to school as soon as possible. We haven't had a hot meal since this morning, and this was almost 5 o'clock, and it was almost 36, 38 degrees Celsius.
That's almost 100 degrees Fahrenheit.
Exactly, and with humidity. So, it's really difficult for families, and they want to go back to normal life as soon as possible.
The Pakistani government says it's trying its best and argues that this is an unprecedented crisis. But do you believe the Pakistani government has done enough in order to prepare these communities for this kind of flooding, for example, by installing early warning systems?
Actually, they have learned from 2010 crisis, but again, it's not enough. And Pakistan is actually facing economic crisis that everyone is aware of. There's a global economic crisis on top of that, the inflation that the country is facing. So enough, of course, is not done, but I think more could be done, of course. But we need to now act and save lives.
Abdullah Fadl, UNICEF representative in Pakistan, thank you very much.
Thank you, Nick.